One of the main issues we've been dealing with here at this conference is mental health stigma. So we put the question out to you today and we asked you, what can psychiatrists do to help?
Well, I think it's difficult, but I think as the public becomes better educated and more sophisticated, emotional issues are accepted as a part of going through life. And a certain percentage of people during a particular time interval may have more trouble than the average person, and therefore we say they have a major problem with anxiety or feeling down or depressed. And I think that that's one way of trying to gather more acceptance overall.
As a psychiatrist, I think we need to ourselves role model treating our patients, their families, and society without stigma ourselves. And that example is probably the strongest way that a psychiatrist could help bring down stigma against mental illness. And then on a more active basis, there's advocacy, working with community groups. But I still think the fight against stigma for mental illness is fought on that individual, one-to-one basis in the eyes of each person who shows up for a little help, and the best help you can give them is to help break their own stigma against themselves.
One needs to learn or help learn that these are not to be blamed. If a person is depressed or not doing well, it is not his wrongdoing. It's like health issue, like if I have a heart problem, I have a diabetes problem, we need to understand it is related to our health, physical, mental health. So it's nothing wrong in coming forward and saying that I need help. Psychiatrists can make it easier to understand that it's not one cause. Like if I have diabetes, I may have insulin deficiency. That doesn't work in mental health. And sometimes people think, well, I'm the only one who is depressed or sad. Everybody else seems to be happy. Unless one goes to talk to psychiatrists or mental health workers, it may be social workers, nurses. There are volunteer agencies, the pastor. They can help the person to learn that it is a health issue. It is not something to feel bad about or blame self.
I think we need to start spreading awareness and talk about psychiatry more naturally and psychological problems more naturally ourselves, and make the community aware of what it means. And stigma is around the lack of knowledge about mental illness and what it's about and what it means. And not to think that autism automatically means that somebody is violent, or to educate ourselves and educate those around us and the general public.
I think that we can we must be more open to the population to show the advances and to make them more approximate to the new advances, and to show that psychiatry nowadays is quite very different from the past. Then, because if you see the history, you can see that psychiatry was almost linked to the prisoners and linked to the sort of torture and so of all the things that we in Hollywood films we see today. That it's very difficult to accept that you have a mental disease. And the advances that we're seeing show us that we have a lot of brain diseases and a lot of diseases that it can be treated by the proper treatment. And we must ensure to show the population and show the media itself that psychiatry nowadays is a medical specialty. It's not far from medicine, from the population. And can you think of the crisis that we are living today, it's very important to assure the population that mental health and mental security health, it's very important to move on this time of crisis, economical crisis, all sort of things.
I think the first thing is to realize that mental illness is really universal, and not just people who have illness. It actually affects us, our families, and our lives. So that really breaks down that separation. I think the other part is really to realize that treatment of mental illness often not only involves medication treatment, but it's really the whole treatment of the mind and the body, and that in treating people with mental illness, that really destigmatizes people because everyone is seeking treatment for the health of the body through lifestyle changes that are profound. And I think just realizing as a frontline worker that we need to treat people who we serve with respect, and that's really what they're reading, is they're not requiring stigma. They really want to be treated as equals and as humans and have a lot of autonomy in their own decision making, and that really, I think, shows respect for people and destigmatizes them.
So we're getting around as many of you as we possibly can, but if we don't manage to speak to you, you can still get involved on Twitter using the hashtag APAAM13.